Hi, this is Dr. Syed Ahmed. I'm infectious disease consultant and I practice in Orlando, Florida. Today we are going to discuss about management of COVID-19. I have summarized it into A to Z steps for the management of COVID-19. The following will be the general guidelines, and certain medications that I'm going to mention are under research, trial, or investigation. As we know, antivirals are sometimes used to manage the COVID-19 early replicative phase, and also immune modulators are sometimes employed in a patient with respiratory failure due to cytokine storm. But therapies should be individualized to the patient's need and clinical scenario. A stands for airway and patient's oxygenation, which is very important. A also stands for antibiotics such as azithromycin, which has shown some role in the management of COVID-19 patients. B stands for breathing and also blood pressure monitoring, because some of these patients are also hypotensive and hypovolemic. C stands for chloroquine and also hydroxychloroquine derivative, which is better. And before we start the patients on chloroquine or hydroxychloroquine, we should check the QT corrected interval to make sure that the patient does not have a prolonged QT. D stands for vitamin D, which is sometimes recommended by researchers. E stands for enoxaparin. So don't forget the DVT prophylaxis in these patients, which are hypercoagulant and high risk for DVTs. E also stands for ECMO, which is extracorporeal membrane oxygenation. This is used for patients who fail usual vent support and have developed ARDS, which is not responding. F stands for fluids. So obviously fluid resuscitation is sometimes required, and also maintenance fluid. Foley may be used in patients who are intubated. G stands for gastric protection. As for other patients who are in ICU, these patients also have high chances of stress ulcers. So Pepcid or proton pump inhibitor may be used. H stands for highly active antiretroviral therapy. Kaletra, darunavir, efavirenz, and some of those antiviral medications have shown some benefit and trials are underway, but there's no proven controlled trial that recommends at this time. I stands for immune modulators, which is sometimes used especially in patients who are displaying hyperimmune response. Also, I stands for infectious disease consult. J stands for jaundice. These patients may have elevated LFTs, especially if they are having cytokine storm. K stands for kidneys, renal monitoring, renal function monitoring, and monitoring of the serum creatinine is also recommended in these patients because they may have acute renal insufficiency. L stands for labs. In addition to the usual CBC, CMP, UA, blood cultures, etc., we should also order for CRP, LDH, D-dimer, ferritin level, and if possible, and if recommended in patients in whom we are suspecting cytokine storm, we can also check interleukin 6 and tumor necrosis factor alpha. M stands for melatonin and is recommended by some researchers. N stands for norepinephrine, which should be on board if the patient is hypotensive. Also, nitric oxide inhalation is being tested in various research trials to see if it's of any help in protecting lung parenchyma in COVID-19 patients. O stands for oxygen supplementation. P stands for pain management and pulmonary consult. Q stands for QTc monitoring. So EKG should be done in these patients, especially who are receiving hydroxychloroquine and azithromycin or any of the QT prolonging medications. R stands for rhythm monitoring. These patients should be telemonitored. S stands for steroids. Solumedrol or IV hydrocortisone has some role in reducing the inflammation because of viral stimulation and hyperimmune response in certain COVID-19 patients. Solumedrol 60 mg daily or hydrocortisone 50 to 100 mg daily. Tocilizumab and various other immune modulators are under trial and may be recommended for cytokine storm. U stands for urine output, and it should be measured daily to make sure patient is not going into renal failure. Also, U stands for UTI, and if the patient has persistent fevers, also consider urinary tract infection and rule it out. V stands for vitamins. Vitamin C and D is recommended by some researchers. W stands for water or fluid management and wound care. If they have been on their back and have developed any decubitus ulcers, then wound care is a very important part of management of COVID-19 patients. X stands for serial X-rays. Y stands for yeast infection. Don't forget that if the patient is having persistent fevers, maybe it's not coming from pneumonia, maybe it's coming from fungal infections such as occult fungemia, etc. Z stands for zinc and zithromax. Zinc is also recommended by some researchers, and zinc has shown some viral inhibition in certain trials. Zinc supplement can be used and is recommended and is of no harm. Thank you. This is Dr. Syed Ahmed. I am infectious disease consultant. Thank you.